Hey guys, welcome back to another Ask the Doctor here with Dr. Smits in Redlands, California. And today's topic will be about meniscus injuries. So Dr. Smits, you see this a lot. Tell us what a meniscus injury is all about.
Yeah, so the meniscus is another part of the knee. It's the padding that goes between the bones. It's C-shaped. It's kind of made of collagen and soft tissue. Absorbs a lot of water. And so it's designed to move a little bit, not a lot. Designed to cushion a little bit, probably not a lot. And we do see a lot of times meniscal injuries happen in sports, particularly sports where you're doing a lot of twisting, cutting, maybe some jumping, and they range from little tears to big tears.
And so obviously as a physical therapist, we see our fair share of them as well. And so you mentioned a few descriptors. Could you kind of expand on what does it feel like, let's say, if you had a meniscus tear?
So, often probably some of the most important symptoms that we ask for are things like locking or clicking. So people will say when they bend their knee, they feel like it gets stuck, it has to release, or maybe at the joint line itself, they feel a click every time they bend it in and out. Swelling is another one of those features that often, can be a sign of meniscus injury. It doesn't usually swell immediately after the injury, but if you play on it or the next day, you'll notice kind of more swelling and fluid inside that knee.
Gotcha. And so what would be the first steps to, proceed with? Let's say sounds like your knee is sounding like that. What would be their first steps?
Yeah, so if you're having any mechanical symptoms, you're having swelling, you should go get an evaluation. Probably one of the best ways to look at the meniscus is going to be an MRI. So, if you have a doctor that is able to get that set up for you, they'll order the MRI and then you'll look at it and identify really, if the meniscus has a tear, what type of tear it has, what's the location, and what's the risk that it could, become a bigger injury.
Yeah, obviously it's a spectrum, hopefully the minimal types of strains or sprains are more manageable, and of course there's severe ones. What are some options? Let's say it's a mild version versus a complex version.
Yeah, so we'll start with the complex. So if it's clearly out of place, if it has a risk, so often these bucket handle tears have a risk to kind of move out of position or out of place. Probably going to recommend surgery. When a surgeon goes in, they're going to look at, is this something I can repair, which happens a lot of times, is this something that should just be taken out, removed. So removal of a meniscus, not ideal, but certainly something that helps relieve symptoms, and we can move forward. So again, that's only kind of the severe cases. For most cases, a mild tear, small tear that has a low risk of progressing, we kind of work it through activity. We give it some time to allow it to potentially heal itself, or the inflammation to settle down, and then put you through a progression of lifting, training, making sure all of your mechanics, your alignment, the hips, the ankles, the knees, everything's kind of appropriate to get you back to sport.
Perfect. What would be a general timeline, let's say in weeks or months, for like the simple case versus the post-op complex case? What would be like expectations?
Ironically, I'd probably say they're about the same.
I
I think the more mild ones, I would quote somebody 8 to 12 weeks, probably just to kind of get fully back to sports and be comfortable. Certainly they're not shut down during that time. Probably we get them moving right away. But just kind of that expectation. More the surgical ones, probably have a couple weeks where you're really restricted, but because a surgery was done, once you're out of that initial healing period, you can actually move pretty quickly. And so I would probably say even close to that. Some people may not even know they have meniscus tear, and they might be able to play right through it. And so those are like the great stories. But for someone who's symptomatic, we'll do things like physical therapy, maybe a cortisone injection, something to kind of help calm down the knee, and get the healing process started right away. And those I usually say kind of give it eight weeks or so to see how you respond to that.
Right, and definitely on that complex side, sometimes they might need a repair, right?
Correct.
And this is repair, and those sounds like takes a lot longer, right? That's 6 to 9 months usually.
Yeah, you want to be cautious. You want to make sure that the sutures have a chance to heal, see how it goes.
Exactly. And so what are the outcomes? Let's say someone's like, hey, I just had a meniscus injury. Usually prognosis is good, or?
I'd say they're pretty common. Most people are going to get back to sport, and hopefully have few symptoms going forward, if any. there might be some pain or discomfort, but really we want to make sure the mechanical symptoms are those that get resolved.
Yeah. And I was going to say, speaking of mechanics too, I think a lot of times it's addressing the initial problem, right? The movement that caused it, whether it be a trauma or a non-trauma. If it's non-traumatic, usually it's probably the way people are moving, and so that's where movement training might be helpful.
It's the meniscus. It takes a lot of load, a lot of compressive force when you're doing things like jumping, and so the more we can distribute that across all the joints, when it's all focused on the knee and on that meniscus, maybe from bad mechanics at first, that can be a setup for issues. So
cool. Well, thanks for listening, guys. We'll see you on the next one.
Take care.